Dr. Ralph May, and in addition to my duties as Chief Clinical Officer of the Community Guidance Center, I am the co-chair of the Indiana County Suicide Task Force. Myself and Bonnie Dunlap have been co-chairs for approximately the last 6 months. The Suicide Task Force has been operational here in Indiana for over 25 years. But in the last year or so, we recognized a need to become much more active in the community. We always existed to help families, survivors, and individuals who struggled with suicide and suicidal feelings. But we didn't feel like we were active enough in the community in raising awareness and in getting the word out there that suicide is a preventable illness. You're going to hear some speakers, including myself, talk about this a little bit before we get on with the walk today. We will not spend a lot of time, but the purpose of this walk is to raise awareness, to make people aware that suicide is a preventable death, something that we can all do something about. What I'd like to talk about now is just some general housekeeping things to get started, and I want to make sure I don't leave out anything. This is Suicide Prevention Week across the United States. So we felt, the Suicide Task Force felt this would be an excellent time to engage in these activities. This first annual Walk for a Wonderful Life is really what it's about. It's about bringing awareness to the public and involving all of us in that process. I can't say enough about the organizers and co-chairs of this event, Steve and Cindy Brown. Steve and Cindy lost their daughter, Dessa, last year to suicide. And that would devastate anyone to lose a family member, particularly a child. But what Steve and Cindy have done is, in their grief, turned it to fuel. The best possible thing anyone can do with pain is transform it into something positive. And this is a beautiful example of how two people who I have deepest respect for have really turned this around into something that prevents further loss of life. Steve and Cindy, as the organizers of the event, are going to be available to you. They have their tags on, and if you have any questions about the event, you can certainly approach them, and they'll be glad to kind of fill you in on the details of the event. This week, there are two other things going on that are very important. On Wednesday, the county commissioners at their regular meeting will read a proclamation on Suicide Prevention and Awareness Week to bring this to the public attention as well. And next Saturday at 8 p.m. at Memorial Park in Indiana, there will be a candlelight vigil to remember all those who have been lost to suicide and in memory of them and in support of the survivors. I want to make sure that everyone's been registered. There's still time to return to the registration area. If you're going to walk, you should have our yellow wristband on so you can walk. If you pay, you'll get your t-shirt. We should have enough left, though I will tell you something, that when we organized this event, when Steve and Cindy really started to move it forward and got the committee involved, we thought we would be lucky to have 100 registrants. Last count, I think we've broken 400. So for the first annual event of anything, that was a tremendous accomplishment. So, just a reminder, we're going to do the walk at the end of the remarks. We ask that if you have any garbage, water bottles or stuff, you dispose of it properly. We're going to carry in and carry out. We're going to leave the place the same way it was when we came in. We ask that no pets other than service animals be on the track during the walk. If there are any questions, all of us are approachable and we'll be happy to answer them. We will put a starting line up and get everybody down once the remarks are done and we have an invocation. I'd like to introduce our first speaker. Our first speaker is well known in the Indiana area as being one of the primary psychiatrists who serve the population of this town at Indiana Regional Medical Center and Neuropsychiatric Associates. He's been well involved in the Indiana community for 15 years, well over 15 years, and is a primary provider of many of the services that help individuals with mental health issues that lead to a risk of suicide. So I'd like to introduce this first speaker, Dr. Stephen Gelfand.